If you are concerned that your fibroids may in fact be cancerous and you don't know what to do, this video is for you. Calling a town meeting of all the sisters out there who have fibroids and are scared as to whether or not their diagnosis may in fact be another misdiagnosis because of the Jessica Pettway story. Thankfully, Jessica was so brave that she shared her story. And in sharing her story, there's so many things we can learn and so many myths we can now dispel. And so we want you to pull up a chair, pull up your tea. We're going to have a deep dive into her story. Thank you for joining us again for the discussion of this very important story. 2 things that you should know: Jessica did opt not to have treatment, and 2, we don't know the history of her pap smear screenings. So I ended up sharing so much, you guys, we had to split it into a part 1 and part 2. So part 1, we're going to focus on, if I have fibroids, how do I know that I really just have fibroids? And part 2, we're going to dive deep into cervical cancer. Thanks for joining us, and don't forget, click subscribe. As some of you may be aware and some of you may not be aware, Jessica Pettway was a prominent beauty and fashion influencer, and unfortunately died as a result of stage 3 cervical cancer on March 11th of this year. She was brave enough to share her journey on social media. And so some aspects of her story we are aware of. And one of the things that she has shared that has caused most alarm is the fact that she shared that her diagnosis was actually a misdiagnosis. She was initially told that her symptoms were due to fibroids, and then later told that she had, in fact, developed stage 3 cervical cancer. She has now passed away at the young, ripened age of 36, as a mom, as a wife, and as an entrepreneur. There are many things we're going to go through today as a result of what she has shared. But it's important for you to know that the information I am sharing today and I'm discussing as a result of what she has shared on social media is really just that, what was shared publicly. Due to HIPAA laws, which are privacy laws that help to regulate the healthcare system, I do not have access to her medical records. And so the information I'm sharing today is simply based on what was shared on social media. There are areas of gaps in the history that I cannot comment on in terms of her personal story, but I will definitely highlight those gaps for you so you know areas that we have information on, and those areas in which we are making assumptions, and areas in which we simply cannot make assumptions because there is insufficient information. But as heartbreaking as her story is, she has shared enough insight that it allows us to have a hearty conversation about not just cervical cancer, but some of the myths about cervical cancer, and then about the expectation in terms of evaluation of things such as heavy menstrual cycles or pelvic pain. And I'm also going to discuss some continued areas of confusion, such as the distinction between a pap smear and a pelvic exam. So most individuals became aware of Jessica's story with her initial post that was on July 31st of 2023. And I would like to read some portions of her post, though I'm not going to spend a lot of time going through on the details that are there, but rather will point to some areas that warrant our attention. And so on July 31st, 2023, Jessica wrote, "I took these photos a few days ago, and it's currently my favorite photo of myself. It brings me so much joy to see how far I've come because a few months ago, I received a devastating news. I was diagnosed with stage 3 cancer. I don't even know where to begin, but I want to share why I've been gone for so long in hopes that at least one person is encouraged by my story." So now we know the reason why she shared her story was in hopes that her story would save someone else. So at that point, this is June of 2023, and she writes, "Last June, I was having intense vaginal bleeding. And when I say intense, I mean I was literally bleeding out. I called around and asked other women if they experienced this before, and the majority of them said they have. I thought, well, maybe this is a quote unquote normal thing that women go through. I was experiencing extreme fatigue, weakness, and just not feeling like myself. But again, I accepted this as quote unquote normal symptom that most women go through." So let's stop there. One of the most concerning things is the fact that because there are conditions that do cause excessive bleeding, that there is an assumption that This is just one thing that women are to accept, whether it's excessive bleeding or pelvic pain symptoms. When the truth is no, just because you're having heavy bleeding, and that may be common among your circle of friends or your circle of family members, it is still not normal. As you see, Jessica shared symptoms of anemia. She was feeling weak, she was feeling fatigued, and not quite herself. At the point in which someone becomes anemic, that means their iron storage levels are so low that they can no longer produce the sufficient red blood cells to keep up with the demands of their body. That is an alarming symptom. So we are not to take anemia symptoms lightly, but to take them as a critical sign that there is a need for treatment and or management and diagnosis of what the underlying cause is if it was not previously known. Even if someone has a fibroid uterus, and let's talk about this, because this was indeed an area of concern, the fact that a lot of women who specifically have been diagnosed with fibroid tumors are oftentimes not believed, not taken seriously, or are told, oh, it's just your fibroids. Well, this is the concern because I have witnessed this myself. Patients who have come to me and told, oh, I've been bleeding heavy for this amount of time, but I'm constantly told, oh, it's just your fibroids. And the thing is, yes, fibroids can cause dysfunctional bleeding and can also cause painful cycles or just chronic pain in general. However, it is possible to have coexisting conditions. It is possible to have fibroids and cancer. It is possible to have fibroids and colitis. It is possible to have fibroids in a UTI. It is possible to have fibroids in endometrial cancer. It is possible to have fibroids in ovarian cancer. So it is important that every episode of heavy bleeding be adequately evaluated to determine whether it is in fact due to the fibroids. It is equally important that every pelvic pain condition is evaluated seriously to determine whether or not it is in fact a woman's fibroids that's causing the symptoms or perhaps another coexisting condition. Let's get into it a little bit more. This is the pelvis, and within the pelvis, ignore it's not quite organized right now, but follow me with this demonstration. Within this pelvis, this entire pelvis here houses several organs. The women's reproductive organs are not the only organs in this thing called the pelvis. Very often, this is the only organ that people focus on. And the truth of the matter is, it is one of several organs in the pelvis that can cause abnormal bleeding and or pain. So when we evaluate, for example, pelvic pain issues, we are to consider not just the reproductive organs, but we are to consider other things, such as the bladder can also be a source of pain. The colorectal area can also be a source of pain. Within the pelvis, you will see what else? These structures here, muscles can be a source of pain. In the back, what do we see back here? This whole structure. People can also have bone as a source of pain, and the other important system that can't be visualized in this structure, but is very key to the function of everything in the pelvis, are the nervous system. Nerves can be a source of pain. So I'm highlighting today the importance of knowing whether or not someone's vaginal bleeding or pelvic bleeding, because sometimes people can't distinguish whether or not the bleeding is coming vaginally or rectally or from the urine. It's important, if you're having abnormal bleeding, to try to see if you can distinguish the difference, whether it's coming from your urinary system or whether it's coming from your colonic system or your rectal or GI tract, or whether it's coming from the vaginal area. And that can be determined by simply seeing where on your toilet tissue becomes red, to basically place the tissue along all three organ systems and see if the red dot is in the front, in the middle, or towards the back. That will help you to determine whether it's coming from your urinary tract, the vaginal area, or in the back, your anus, which represents your GI tract. Now that we've gotten that clear, most women I have learned over the many years of working in the field know what their fibroid pains feels like, and they know when that pain is different. And sometimes fibroid pain can also change because someone may then develop a degenerating fibroid, which we've talked about before. So go hit up that video that we talked about fibroids on, and you'll get a lot more details and will understand the lingo that I'm using in this particular video. Women who have degenerating fibroids may sense a change in the type and the characteristic of the pain that they're having. But again, if they undergo adequate evaluation, the conclusion and the appropriate conclusion will be drawn. And I say that to say most women know their fibroid pain or symptoms, and they also can tell when something is different. And it's important, if you detect something is different about your pain or your bleeding pattern, then it warrants further evaluation. And here's the other thing. There are limitations in determining the presence of certain types of reproductive cancers, for example. So ovarian cancer and uterine cancer, there are no screening tests as we do with the cervical cancer, which I'm going to talk about in a little bit. Ovarian and uterine cancer, there is no screening test. We basically do diagnostic testing. And it's important to understand what screening tests do and the purpose of a screening test, which I also discussed in a previous video. So some of you ladies may have to catch up a little bit with our other videos to kind of get some foundational knowledge on some of the things I'm sort of walking through a little bit quicker in this video, because I want to focus on really key elements of Jessica Pettway's story. That being said, the presenting symptom for endometrial cancer, which is the inner layer of the uterus, the cancer that forms in that layer is oftentimes vaginal bleeding. And so when women who are in the age group in which uterine cancer is more likely to occur, that would be your 45-year-old women and older, then any type of abnormal bleeding will lead to sampling of the endometrial tissue, which is called an endometrial biopsy. However, they are not the only women, so let's not get stuck there. It's also important that other women who have high risk factors or who have what we call refractory bleeding. So someone may have bleeding and it's really heavy, and we think, oh, it's their fibroids, because this is very typical pattern for their fibroids. But let's say we have tried several types of management or several types of treatment, and they're still consistently bleeding very heavy. And that is an indication to do further evaluation, which in many cases should include sampling of the endometrial cavity. Now, there are other types of cancers that you may or may not pick up by sampling the endometrial cavities. For example, leiomyosarcoma. Leiomyosarcoma is a cancer of the smooth muscle cells. The bulky layer of the uterus contains smooth muscle cells. And that same smooth muscle cells, as with any particular tissue in the body, can become dysfunctional and can develop into a type of cancer, which is leiomyosarcoma. Leiomyosarcomas, for the most part, act very similar to fibroids. They are very aggressive, and the symptoms will oftentimes be very severe or very rapidly progressing. So women who unfortunately are affected by leiomyosarcoma will have more severe symptoms, may have progressive growth, rapid growth of their uterus. These are alarming signals. So uterine fibroid in general are very slow growing tumors. If you have rapid growth, excessive bleeding beyond and above what is typical or considered to be common, that warrants further evaluation. And so again, advocating for yourself, if your symptoms have changed, there is something different, and you feel that this is not my usual fibroid symptoms, or you feel that I've never been diagnosed with fibroids before, and this kind of seems a little bit severe, it warrants evaluation. And that being said, the other thing I wanted to point out with what Jessica shared is that she called around to people she knew. Makes sense, right? Black women especially are always looking for some source of validation or some source of information to determine whether or not our symptoms are normal or abnormal, simply because oftentimes we encounter such discriminatory practices in the healthcare system. So she did what is very much typical of Black women, is to call around, is this normal? Am I normal? Should I seek medical evaluation? And I would say, always ask your clinician. Find a physician or a clinician that you have a good relationship with so that you can ask your clinician, is this normal? It's okay to also kind of get a sense as to what other people experience, but you have to have a caveat to it. And the caveat is many Black women are affected by fibroids, and many Black women have very severe symptoms from their fibroids. And so asking a group that's more likely to have more abnormal symptoms and have known disparities will not necessarily give you insight on what's normal. So essentially, everyone is having abnormal symptoms, but because it's common among the group, it is then recharacterized as being normal. So it's very important to get multiple insights on your symptom. If it concerns you, it should concern us. Jessica then went on to share an unfortunate incident that subsequently happened on July 1st in 2022 at 4 a.m. She writes, well, on July 1st, 2022 at 4 a.m., my husband found me in the bathroom unresponsive and not breathing. I had literally passed out. He called on Jesus to bring me back, and I came back. I was rushed to the hospital where they told me that the extreme blood loss was due to fibroids. My gyno made it seem like it was so normal and common. I didn't think much of it. However, I was passing clots the size of a placenta, which was really alarming. They kept me overnight and released me the next day. Fast forward to July 22nd. I was hospitalized again for the same thing. Again, medical professionals treated it like it was not that alarming since it was just a fibroid. Again, the same thing. Medical system also needs to change, right? So the medical system too has this preconceived idea, and I will tell you, this is unfortunately common that I've encountered, especially when patients go to the emergency room or have been seen by other professionals, that once they are diagnosed with fibroids, everything becomes because of the fibroids. I have seen women who were later diagnosed or determined to have appendicitis, to have a bladder issue, to have GI issues that were initially brushed off as just fibroids. So not only does the public need to be aware, but even the medical community and other specialties need to be aware that everything is not just fibroids. Also to mention the effect of severe anemia. I want to touch on something before we move forward. Jessica also mentioned that she literally passed out and she wasn't breathing. This is again why we need to take anemia very seriously, because severe anemia, that means your critical organs are not being oxygenated. When you have severe anemia, you do not have the capacity to carry the amount of oxygen that is needed for your vital organs to function. So you can have a heart attack as a subsequence of anemia. You can stop breathing as a subsequence of anemia. You can pass out as a subsequence of anemia. So it's very important that we take anemia very seriously. We're going to fast forward a little bit. We're now in 2023, basically in the duration between the last part of her post that I shared and where we're going to catch up to now. She had been rehospitalized, going back and forth to different medical professionals due to her heavy, severe bleeding and subsequent anemia as a result of that. She has had multiple episodes of multiple blood transfusions. I believe at one point she also got reported being transfused 10 units of blood. We're talking about severe, severe anemia. And we're talking about subsequently as a result of severe bleeding. If you were bleeding that much that you weren't, she basically bled out her volume of blood in her body. The average human adult has about 8 to 10 pints of blood. She had 10 units of blood transfused. Do the math. She basically replaced her blood volume. And depending on the size of a person, that may vary how much the blood volume is, but that's about the average. That just gives you an insight as to how severe her bleeding was. So we're fast forwarding, and she writes, as I went for my appointment, this doctor asked me if she could just look down there first. She was the first to show some concern. I told her it was okay to check. It didn't take her long before she looked at me and said, she could not even see my cervix because it was blocked by a huge mass. She scheduled me an appointment with an oncologist that following week. On February 8, 2023, remember when this all started, right? On February 8, 2023, he performed an outpatient biopsy on me. When I woke up from the anesthesia, he casually said, in quotes, unquote, yep, you have stage 3 cervical cancer. It turns out it was not a fibroid, but cancer. I was misdiagnosed all this time. Again, very alarming experiences that Jessica endured. The casualness of reporting cancer. And, unfortunately, sometimes in our specialties, especially our specialties that deal with death very often, it is very possible to become callous, to become very numb to the poor outcomes, a poor diagnosis, or even death itself. And it's so important as physicians that we're able to self-monitor and have a system that is actively monitoring the mental wellness of clinicians. And this is something we touched about previously, the prevalence of mental health conditions in the field of medicine as a result of dealing with some of these over and over these tragic experiences. And that's something the healthcare system can do way better on, because the outcome is really what patients are experiencing, like the casualness in giving a devastating diagnosis of cancer. So we're going to talk about a few things. One of the things, before I get into cervical cancer, I do want to make sure that everyone is very clear that Jessica died basically a little bit over a year from the time of her diagnosis of cervical cancer. This is not typical. And it is very important to know that even though it wasn't shared in her main post, in some of the public communication, it was disclosed that she chose not to be treated. Jessica relied on her faith for the healing of her cervical cancer. That is the walk that she chose. And so some of the information that I'm going to share about cervical cancer and the survival rates doesn't pertain to someone who has not been treated. I will be sharing information with the assumption that the individual is being actively treated for cervical cancer. I just want to make sure that's very clear, because I think some of the fear that went out as a result of her story was the thinking that most women will feel that if they are diagnosed with cervical cancer, that it is such a rapid cancer, and that is not at all true. Cervical cancer is a very slow growing cancer, taking an average of anywhere from 15 to 20 years, depending on the sources you use. But most people agree it's somewhere between 15 to 20 years from the time that your cells become abnormal to the time of developing actual frank cervical cancer. It's very important to know that. And that is why cervical cancer is one of the cancers in which a screening can actually be effective, because a screening has the time between the onset of disease to possibility of cancer that is so long that it gives us the opportunity to get rid of those abnormal cells rapidly in between to prevent the actual outcome of cervical cancer. So that's why cervical cancer is eligible to have a screening process. One, because of the efficacy of treatment, and two, because of this long duration that exists between the standard cervical cancer and the initial onset of abnormal cells. Making sure that that's clear. So let's get into some of the really key details about cervical cancer. You guys, I had so much to share, I didn't realize I was actually doing a lecture. So let's stop right here, give you some time to digest the information I've already shared, and let's hop right back into this and really get into cervical cancer in the next episode. See you then. So I am Dr. T, the hand behind the handle of Healthy Bum Club right here on YouTube, and also the hand behind the handle of Healthy Bum Club on Instagram. We thank you for watching. Make sure you check out our other videos, especially our videos on fibroids and on HPV and on sexually transmitted infections right here on our channel. And we look forward to seeing you when the next episode. Rest in peace, Jessica Pettway.